Are they brand new or have you used them before?
What are, if they're not brand new, what are they?
Look up
What date?
Date. What about the date?
It's got to be within either 24 or
24.
48.
24. Okay. And you have to have expiration dates. What do you think about the fluids? Peroxide. What do you think about peroxide?
You're going to dilute it. It's not going to be straight.
You're going to dilute it. Some hospitals are not going to even use it. So what would guide your trach suctioning at any specific hospital?
The policy.
Policy and procedure. Protocol. So every hospital has policy and procedures. And I will tell you, there are hospitals who will not find hydrogen peroxide on the floor. Why won't you find hydrogen peroxide on the floor?
It's actually counter to healing.
Why is it counter to
It destroys
healing?
the cells, I believe, the white
It
blood
destroys
cells.
the cell, good and bad. Why does it destroy the cell?
Deprives it of oxygen.
Correct. Why does it deprive it of oxygen?
I don't remember.
Because it's hydrogen peroxide. What is the weakest thing on the element? I'm just rolling back to chemistry. Hydrogen is the first one on the periodic table. Number one, it's the weakest. What does it attach to? What is our balance in our body
oxygen.
guided on?
Oxygen. The hydrogen's going to attack the oxygen.
We have
right?
hemostasis. Our body really runs on a delicate pH. Water is slightly acidic. It's on a carbonic amylase chain, basically, and we shift back and forth. Hydrogen releases, and we go base. Hydrogen attaches to something, we go acid. Okay? The last thing in your cell, let's go back to Krebs cycle. Yeah. But it's so important in nursing, and that's why I'm going to bring this up and make you guys think about it in critical thinking. The last thing any cell in our body does with ADP, ATP, the production, what stops the cycle, Krebs cycle? Oxygen. Otherwise the cell will die. It keeps moving until it dies, basically. So you need oxygen-rich environment for your cells, correct? We're going to put hydrogen peroxide in. What happens to the oxygen at the cellular level?
It attaches to that.
Attaches to the hydrogen peroxide and it bubbles out. Now your cell doesn't have oxygen anymore. And what happens?
All done.
It dies. Okay? And research shows that you don't use it on wounds, so some hospitals won't even let you clean them. And let's face it, if I take this trach out and it's really gross and you can't clean it and you can't brush it, what are you going to do? Okay? Throw it out. Check your policy to see when the trach is supposed to be changed. Maybe you shouldn't be cleaning it. Maybe you should just be setting up and putting a new in there. Suction in, no. Okay? The video here shows suction in the inner canyon. Some hospitals will not let you do it. Policy and procedure will dictate that. Unless there was a real obstruction in the inner cannula, I've never suctioned. What is the policy to suction? Put suction in. Okay? So, best thing to do is come in, set up your suction, identify yourself, pull the curtain, explain the procedure, put your suction. The video here says 80 to 120. Most hospital policies will tell you don't go over 100. It's based on your policy or your hospital. ATI says 80 to 100. Okay? Someplace in that range. Because if you can't suction something out, is it really good to turn the suction up to 150, 160? No. You don't want to damage the skin. So I always set my canister up. I always check my suction here. Bring your thumb over it. Okay? I know the suction's ready to go. I don't do the laundry in the hospital, so I use a lot of towels. Because they're cheaper than trucks and they're not as hot. You know, trucks will really get hot. We will use trucks for cleaning material because how we are getting fluff. So what's the first thing I'm going to ask? If the person's on a ventilator, you'll do it manually. Or turn the vent off. Take some deep breaths. Can you turn your oxygen up temporarily? Hyperoxygenate the patient. Mr. Smith, can you take some deep breaths? And he's going to take some deep breaths. You've seen in the one video they never touched this after they took it off. In the video that they showed here, they kept putting it over, and they took the dressing out. I kind of have an issue with that. You take the dressing off on a fresh tray, and then you do this, you're introducing bacteria. Okay. Generally, what I do is I position this in what I call blow by. Okay. I get it up to the side. I get it down here. I turn the oxygen up because the room has 21% oxygen in it, and if you're blowing 80% past here, you've increased the oxygen up to 40% or so. So you do hyperoxygen. So I do a blow by. Okay. I always do it with a friend, and we can do that afterwards. For these purposes, you guys set them up by yourself. If you use hydrogen peroxide, it's a 50-50 solution. I always set up two trays, and then you lift the tray, and why I do that is I set up a sterile field and I have a place to put my gloves on. You'll have a lot of people set the gloves up or set a sterile field up on a patient. I never do it because it's just one of my quirks. I won't do it. I want my sterile field up here, waist level or higher, and I want to be able to protect it. Can I protect it on a patient? Very difficult. They cough,
They
roll, and they're gonna. So I set up my sterile field here. And there's different ways to do it. I took my lab coat off for a reason. Because when we're in the hospital, we have this stuff on and their shirts on. Number one thing that students get in trouble for is breaking the septic technique and not realizing they do it. Get your sleeves rolled up. Make sure your sleeves aren't going to drag through. Make sure you don't have anything hanging. The video is really good. The guy's got tape hanging and it's swinging all over the place. Touching everything. So, there's several ways to do this. You open this up, right? All your kits should be in a specific order so you can get stuff out. If not, you may have to open a pair of sterile gloves at this point if it's all messed up. Your kit should be situated so you can pick up your, just like a Foley kit, right? 1 inch border. Can you touch that? Okay. Put it down. I ripped this right off. I didn't, but I rip it right off. Generally, if you can pick this up, you can dump it without an issue. Okay. Do I like doing it like that? No, because there's a lot of room for error doing that. But that's the way they show you. You gotta do it like that. Okay. If I had a partner, what I would do is explain the procedure, get the blow by, get ready to suction. I'd put on my sterile gloves, and I'd have Jamie open my kit. I'd set up my field, pull it out. Then I could pull all my stuff out. I'd have her lift the bottle, I'd have it pour it in. If you're just doing trach suctioning, and you bring in a bunch of equipment, I bring in a packet with sponges, packet with split dressing. I just put them on the table, okay? I open a small kit like the other ones that they have here. And these don't always have a sterile field in them. All they have is a pair of gloves, sometimes a sterile field and the cleaning stuff. Okay? You can dump that out. I will have Jamie open everything for me. And when I need a 4x4 or I need a pad, I simply have my friend. He's got gloves on, of course. Open stuff, go from the middle though. And open stuff like this. This is still sterile. I reach in with my sterile hand, right? And it goes very quickly with a friend. Okay?
Could you?
We're setting up.
The one video said you could put sterile gloves on and then empty the contents out.
Correct. You put
Okay.
your sterile gloves on and empty the contents out. Take those sterile gloves up once you get things situated around, because you still have another pair of sterile gloves in these kits usually.
So you could do that.
But they're one size fit all, and they're not really great if you have big hands, or you need a different, or you have really tiny hands. You probably need to go get sterile gloves that fit. Okay. I'm going to open my suction catheter, and that's going to go on the tube. Okay. Thank you for doing it by yourself. And you can do it in any order you want. It's up to you. I'm going to take my bottle, I'm going to check the dates, within 24 hours. I always have my garbage can sitting here next to me when I set up. Okay, because you really don't need a red bag unless it's copious amounts of infection or blood. And if you're on contact precautions, I'm going to lip my bottle. I got the garbage here so I can lip it right in there. I'm going to pour, use my 50%. If I want that process, I'll do that. And they're ready to go sterile. And I am turning my back, and nobody's monitoring anything. Okay. So I'm going to have this opened up. And you guys are going to probably want me to go sterile so I can see if I can do it. Right? Can you go in the garbage? Beth, is marked on this one? Alright. What am I going to do with it? What haven't I done? Thank you. He's got to nail me on this stuff. Okay. I did hand hygiene first. Okay. Now I come in here. I don't care how you do this. And I do it sometimes right from the first, sometimes left from the first. Right? And this goes to the one. It's really hard for me.
Dry it out.
Okay. Let's go sterile it. I can throw it away and do whatever I want with it. Okay. Take some more deep breaths, Mr. Smith. Always assess your patient. I've already listened to lung sounds. Respiratory sounds. Okay. I'm going to set up my sterile field. However you want to do it. In this case, this one in good? No. I throw, right? Just the outside. So I throw this one away. Okay. And these kits aren't going to be all a mess like this. You're not going to get to keep this stuff. I don't do it like this because most of the small kits will come with a Q-tip or usually just a pipe cleaner and a brush. And then I'll have my friend helping me Q-tips. And the tip in the package and I pull them out one at a time to use. Okay, so I'm pretty well ready to go, I guess. I keep one hand fairly sterile, one hand can go dirty. Okay. Different ideas you can do with this. If you have a barrier, a sterile field with a barrier, you can wet this now instead of this side. You don't have to pull out the barrier. Okay. And you'll need a wet sponge. So, I don't care how you do this, just keep it sterile. I'm still sterile with this thing, so I can coil it. I can do whatever I want. Coil it can be an issue trying to uncoil it. So if you do coil it in a fashion so you can uncoil it pretty easy. So that's up to you. I keep my coils in the top, and you can always do this basic check suction. Pinch this off, technique it, or you can actually go in one of your vats and use suction. If you mix a 50-50 solution, do not go in your mix. And you'll have a lot longer suction period in this. Okay? We're going to come up, Mr. Smith, I'm going to suction you. You're probably going to cough, but feel free to. Okay? Catheter goes in until you meet resistance, because then what is it? Rhino. Patient's going to cough. Intermittent suctioning. And the video showed you this. Some hospital policies will tell you, till you meet resistance, back 2 centimeters, 10 seconds of suctioning coming out. Okay? So it's however fast, you turn it back and forth a little bit, or you move it up and down. Moving it up and down is tough sometimes because you get wrinkle in the trach and it causes more irritation. So you're going to turn it back and forth, intermittent suction. Then I usually pull it out and I hold suction for a second, see if the tube clears. If it doesn't clear because the secretions are really thick, you can suction it out of one of your vats again. Then go back down till you meet resistance, back 2 centimeters, intermittent, and turning back and forth, out you come. Okay? Hospital policy and procedure will tell you how many times you can suction the trach. Alright. I'm done, right? I'm done with the suction? Not by the way this video did it for the lab. Okay? This video said to take out and do the inner trach. Read your hospital policy and procedure. Because some of them don't want you touching the inner trach. Like I said, I've never suctioned the inner trach. And the doctor usually did it for yourself. Okay?
I actually suctioned somebody the other day at the hospital, and we didn't pull anything out. We just went straight down.
A lot of times that's all you're going to do. You're not going to clean that. A lot of times you're going to do suction. Suction procedure is over with at this point. Okay? You only have to do trach care every 8 hours, every 12 hours. You can suction PRN as needed. So if it's PRN as needed, you're just going to be, I'm done now. Okay? So if the policy says you can do the inner cannula, at this point you're going to have to pull. This is where it gets tricky. Go under, put it in your solution, okay? Back, and you're going to just go to the end of the trach. Remember that trach's only about this long. And you're going to suction. Technically, there could be nothing in there. Because this one's a little bit longer, or as long as the other. So unless there's something stuck on this end that comes up and gets left there, generally there's nothing there. And by suctioning that first, you should take all that out. Okay. I'm done. Okay? I'm going to throw that in the garbage. Get it out of the way. I'm going to come over here. I'm always going to keep looking at my patient. I'm going to assess. This is still sterile fluid, still no sterile hand. Get it out. So, one video showed people doing this. Don't do this.
Splatter.
Freak out. Yeah, because when that comes off, you're splattering something. So people come down and they clean this out. Okay? Some videos show you going from the other end. I don't. Open this up. You're going to put down in water. Normal saline, I should say. And then clean it. Okay? I'm done with the brush. Done with the brush. Unless there's garbage in there and you want to take a pipe cleaner and you don't use this hand, so just don't sterile technique really, but it's sterile to that patient, basically. You might have to wet this and go down in. Okay? I'm done. I cleaned it. I put it in this vat is how I do it. I shake it back and forth a little bit. I pick it out and then I tap it some places. I don't very well. The video shows running it like this. Take it out of your vat, hold it, go this way, throw this one out, grab a pipe cleaner, throw from the bottom. Okay? Am I done? If you can't clean it, what are you going to do?
Replace it.
Replace it. Okay? Some of these trachs are funny, some of them when you put them in, has to go up and then turn down. Okay. I'm gonna snap it in. This thing's still sterile, right? Got my towel across there. I'm going to pull out the dressing. At this point, the old dressing, I'm going to throw it away, and I'm going to assess that. There's a lot of secretions on it. This is where you can take your 4x4, dump it into that you haven't used yet, bring it out, okay, and then you're going to clean it. Burn up. Maybe use another corner or get another one. Alright? I'm going to throw it away.
Is that okay to use if you checked for suction in there?
Yeah, because it was sterile when I checked for the
Okay.
suction. Now if I rinse it, it's no longer sterile.
Okay.
Okay? That's why you got to be very careful about what bats you use.
Okay.
I can dunk this Q-tip in here. I usually go from the top. Throw this one away. Get another one.
Are you no longer sterile?
This hand's sterile.
The one hand because you cleaned with the 4x4 with that hand, and then went back over with it. You can do that?
I'm sterile to that patient, and when I clean, you keep your hands off the patient.
Do you have to necessarily use it, or can you use just the Q-tip?
Just the Q-tips.
Or could you drop it?
Unless there's a ton of
If there's a
cases
ton of
on it.
secretions, this Q-tip's not
Right.
going to cut it. Okay? So I take my second Q-tip, moisten it, I clean underneath, throw this one out. Okay? What's left?
The dressing.
Rinse off my sterile field. However your technique is to do it. I go in from the side and work my way up. Okay? And there's two here.
That's when you're done cleaning, so it's
I
not
think the
sterile
only thing that's
anymore,
really gotta
right?
be
It's not
sterile
sterile no
is
more.
the cleaning and the suction.
The cleaning and the suction has to
And
be
then
sterile.
after that, you're
When
good.
you tap the trait, you tap it on the sterile field?
You can, or tap it on the edge of your container, or just dry it with a pipe cleaner. Sometimes you end up using all your pipe cleaners, and you don't have that, so then I tap it out or I shake it out for you.
If you did it on the field though, wouldn't you have to have the barrier?
I'd usually do it on a corner, and you want the barrier so stuff's not going through. Or you can tap it on the wall, and then you gotta watch out for that tap. Tap it here. Okay, or have somebody go get you more pipe cleaners. Okay? Now what am I gonna do?
Reassess
Listen,
the
what
lung
do we
sounds.
call that?
Auscultate.
We're gonna auscultate upper airway and lower airway.
Are we redoing the ties at all, or no?
Protocol policy dictates different things. It's not on your critical sheet.
No.
If you ever do it in the hospital, it's a technique you do not do alone.
By yourself.
Okay? Never ever do it alone. Somebody has to protect that trachea out there. Once the tie's off, trachea go. Questions?
At the beginning of this, I didn't hear you say it, but wouldn't it be appropriate to have a spare trach set?
Spare
in
trach.
case- A second in case
Should be at
this.
the
That's your
bedside.
safety.
Should be kept at
That's
the
your
bedside.
safety. Spare trach at the bedside.
Bag.
Spare trach kit. Little kit at bedside. What else?
Bag for early in there.
Bag though. Every bag is at bedside at all times. Go through the procedure without it. It would be well when you do a touch with this thing that have an EMV bag. I really need you guys to get in here and practice.